Hi, I'm Katie Toma, President and CEO of the Chico Chamber, and today I'm here with Casey Hatcher, who's the Deputy Chief Administrative Officer for Butte County. And I like to refer to Casey as the COVID czar for the county, which she always kind of laughs about. But she has been the go-to person since this all transpired the beginning of March. Many of you may recognize her from the campfire. She was the public information officer for the first 6 months and then transitioned into the recovery effort. So Casey has, she's just been such an integral part of keeping all the parts together and everybody moving in the same direction. One of the reasons why I believe that Butte County has done so well as far as coordination of jurisdictions and organizations and nonprofits is because of Campfire, because those relationships were already established. Everybody had each other's cell phone numbers in their phones, knew who had the resources. So Casey just got on that and coordinated those efforts. So Casey, I just want to start off by saying thank you for the good work that you have done and your dedication and commitment to the citizens of Butte County. You really are appreciated. So thanks so much. But today we're here to talk about some great things that the county is doing and helping out business owners. So here at the Chamber, we get lots of calls or emails from business owners saying, my employee is telling me that their roommate has symptoms of COVID. What should I do? My employee's family member has been tested positive for COVID. What do I do? So there's, and of course we refer them to the county, we refer them to the California Department of Public Health. So you've come up with these great flow charts that are really easy to understand, and they're great visuals. So Casey, welcome. Enough from me. So if you could share about what's happening in the COVID world for Butte County.
Well, thank you, Katie. I'm not sure about the COVID czar, but I appreciate it. The county was really thoughtful when they took the step of creating this liaison position between public health and our public and private agencies and businesses that are affected by the governor's stay-at-home order. And we want to do everything we can to support businesses. And a lot of that includes information. And so we get more and more of those questions that you just mentioned as we have cases increase in our communities. And we know that businesses are concerned not only if one of their employees tests positive, but what happens if there's an exposure in their business. And so we get questions from, do I need to shut down, to how long do I let employees stay home? And we'll talk through a few of those today. I'm gonna go ahead and share my screen and walk you through some of the charts that we have created for businesses to help in the response to COVID. So you should be seeing on my screen, this is a one-page COVID-19 exposure, what should I do chart that was created really for the general public, and then the starting point for the more detailed resources that we've put together for business owners. And what's helpful about this, Katie, is that if you have been directly exposed, meaning you've been a close contact, and it shows here what a close contact is. If you've been a close contact to someone who's either tested positive or who is being tested, then you should self-quarantine and self-monitor. So if you have a business owner that's asking you, I have an employee who has a roommate, and so it's someone in their household who they are likely a close contact with. It's a little impossible to not be a close contact with people in your household, and that individual is tested positive or is being tested, then your employee should be self-quarantined, and that means that they should be staying home. Right? So it says down here at the bottom, what do these different steps mean? There is also a possibility that maybe you were in contact with someone who has been exposed to someone with COVID-19. We get a lot of that. My friend's girlfriend's brother went to a party and they said that someone there might have had COVID-19. And so this chart, I think, is helpful to understand, what about those once removed contacts? What should we be doing if we've been in that situation? And really, this second level here is that people should be self-monitoring. And again, this is what that looks like. We're checking for symptoms, we're taking temperatures, we're calling our medical provider if we have a temperature higher than 100.4. And then we're also being extra diligent about maintaining our physical distance, staying home as much as possible, staying 6 feet away. We're avoiding close contact, and we're wearing our face covering. All things that we should be doing anyways, but being extra diligent about those pieces. So I think this is a good, just kind of one-page flow chart for what to do, and it can be really helpful both for individuals and for employers.
That's super helpful. That's great.
So in addition to that, we know we created some more detailed flow charts, and there are 3 different pages here, and I'm zoomed in a little so you can see it hopefully on the screen, because we do get a lot of questions from employers about what they're supposed to do when an employee tests positive. In many cases, the employee will be the first person to tell the employer, because typically that test result comes back first to the provider and the individual, and then is provided to public health. So they may find out that same day or the next morning if that test result comes in positive. Sometimes what will happen is the employee will call the employer first. We are asking if that happens and an employee lets you know that they have tested positive, that you call into the Butte County COVID call center at 55250 or 3050, and they will begin to connect you with public health so you can start to get direction about what to do in your facility and with the rest of your employees. In some cases, Butte County Public Health might be the first to notify you. And so this flow chart really just walks employers through how to handle that positive case within one of their, an employee. So if that employee is already home, please instruct them to stay home. I actually talked with a business owner yesterday, and he said, you know, I had my employee come in to tell me that they tested positive. And I said, I think you can tell people they can call that one in. So if they're home, go ahead and instruct them to stay home. If they're at work, please send them home immediately. And then this is where Butte County Public Health starts a very collaborative process with the employer. So they are going to work with the employer directly to really identify if there's been close contacts at work. And again, you saw in the previous chart what really defines that close contact. We talk about less than 6 feet for more than 15 minutes, and that includes if you're wearing a face covering. So just because you're wearing a face covering, if you've been closer than 6 feet for more than 15 minutes, you're considered a close contact. So they are really looking to define what that infectious period is for that positive employee and to see if there were other close contacts at work. Now, we hope that businesses have been having all of those mitigation measures in place and following that guidance from California Department of Public Health and Cal OSHA, which is on the covid19.ca.gov website, and eliminating as many close contacts at work as possible. There is this comment in here, which I think is really important. It's not always the case that Butte County Public Health will contact you as an employer if one of your employees tests positive. So for example, if you had an employee test positive, but their infectious period did not cross over any time that they were at work and they didn't have any close contacts as a part of the case investigation that public health did, they may not need to contact you as an employer. So there could be circumstances where that would happen. It doesn't happen a lot, but it's possible. If you did have an employee that had an infectious period at work, in your back and forth with public health, they're likely going to recommend that you assess the facility. So where was that employee, and make sure you're doing a really thorough cleaning. A lot of that is probably already happening if you're doing the regular sanitization of your facility, as is laid out in a lot of those state guidance for being open. And then this again is a collaborative process right here in green that shows that Butte County Public Health will work with you as the employer to contact individuals that may have been close contacts. And Butte County Public Health will be providing direction to those close contacts. So as you remember from this chart, if you are a close contact of someone who's tested positive, you are going to be self-quarantined. And so if you have additional employees that were close contacts of the infected employee, they will be directed to quarantine. So it's, again, a really good reason why we want to limit as many of those close contacts as possible at work. One really big question that we also get, Katie, from employers is when can my employee return to work? And it's important to know that as an employer, you can ask your employee to both get a release from work from public health if they are supposed to be isolating or quarantining. And you can also ask them to get a letter verifying that they can return to work, that they have met their isolation or quarantine period. Those documents don't typically come directly from Butte County Public Health to the employer, so you can ask your employee to get them and provide them to you. Does that kind of all make sense?
Are you finding a timeline from the time of testing until they're able to return to work? Is there any sort of average, or is it a couple weeks, or does it just depend on the person in the case?
Well, that kind of brings us to this next flow chart, which is returning to work after positive, after testing positive for COVID-19. So there are some very clear timelines associated with that. Anyone who's self-quarantined because they were a close contact should stay home for 14 days. Anyone that has tested positive should follow this guidance here for when they can return to work. And there's two pieces. So many people don't have symptoms, and sometimes they received they got a test because they were a close contact, or if they had symptoms, maybe they got a test. So you're looking, say if you had symptoms, for at least 10 days to have passed since symptom onset, plus they no longer have a fever for 24 hours, not using fever reducing medicine, and their symptoms have all improved. So this is additive here, right? All of these things have to exist for the employee to return to work. And again, they will be working with Butte County Public Health if they are positive for COVID-19 and can get that release back to work letter. So if an employer wants some additional assurance that they can be returning to work, they can absolutely ask the employee to get that from Butte County Public Health.
Great.
If it's someone that tested positive and didn't have symptoms, it's at least 10 days since the positive test result resulted positive that they can return to work, and making sure no symptoms have developed. So these are big ones that we get questions for. And then, as I mentioned before, for someone who might be self-quarantined because they had exposure to someone who was positive, that timeline is 14 days. Now, if that individual develops symptoms and ultimately gets a test and is positive, then they're into that other period of time here about when to return to work for individuals that have tested positive.
Okay. So it could be a few weeks. Yeah.
Typically it's about 10 days for individuals that test positive and 14 days for individuals that are quarantined.
Okay. Very helpful, very helpful. So if there, and one of the things, if you can go back up to the top, the links that you've provided, I think that's also, people really want to get kind of into the weeds, that Public Health, California Department of Public Health has all kinds of guidance, but this is really the nuts and the bolts for business owners and for individuals. One of the things you said, and I didn't realize this, that even if you have a face covering and you're in close contact with somebody more than, you're considered to be in close contact with somebody if you are together for 15 minutes or more.
In less than 6 feet.
Yeah, less than 6 feet. Yeah.
I have talked with a number of people that were surprised by that. This chart here talks about examples of close contacts, and I think people have heard that if you're within 6 feet for more than 15 minutes, that would be the point at which our investigators that are looking into the cases for all of these and tracing all the contacts for all these positive cases, that's how they're determining a close contact. That's a CDC guidance. And it doesn't matter. It doesn't matter if you're wearing a face covering. It's the proximity and the time associated with that. Because as we know, while the cloth face coverings are very helpful, they aren't 100%. They're extremely helpful when we are out in public and we are having limited exposure passing by someone in a grocery store, or as we're walking down the street in downtown Chico shopping at our favorite local business, something like that. We want to be wearing those cloth face coverings. They're extremely helpful to limit the spread, but they don't eliminate the requirement to stay 6 feet apart from people that are not a part of our household.
Okay. More clarity. Hopefully we'll all be experts by the time we're through this, right? Which will
That's
hopefully
right.
be soon. So, so we talked a little bit prior to filming here about the testing, and that it is taking some time for testing. So potentially, if you go in and and I've been tested a couple times, only because I'm front, public, interface,
Sure.
and I know that the result. I went out to the fairgrounds, and it was 5 days. It was pretty quick. But I've heard from others that have gone to private places that it's been as much as 2 weeks. Does that depend on the lab? Is that the difference?
Yeah, I think we can all agree in this county and this state, we are not pleased with the turnaround time for test results, and it is a hurdle that public health has in its toolkit that is part of the containment strategy. We wish that those test results could be turned around faster. A lot of that has to do with the lab capacity. So that OptumServe site at the fairgrounds in Chico is a state site. We are so thankful to have that site to do the specimen collection, but they do have to go and send those out to labs. And depending on where you get that test done, whether it's at your provider, at the hospital, at CVS, at that OptumServe site, those all go to a variety of different labs. And so the turnaround time for those labs can really vary. In addition, the state just a couple of weeks ago changed the guidance for testing, and you can find that on the CDPH, that's California Department of Public Health website, under guidance documents. They have now outlined 4 different tiers for prioritization of testing. And so even though, like you and I, Katie, maybe go to that OptumServe site and get tested, our lab result may get prioritized. So someone who's symptomatic or in a hospital, the turnaround time for them may begin to follow that prioritization that the state has outlined for testing. And those results for asymptomatic individuals or others further down in those tiers may take a little bit longer, and it can and is frustrating, I think, for all of us. But we do think that these types of tools, these flowcharts, will help to understand what we should be doing in the meantime while we're awaiting test results, so that we're not spreading the virus to others should we come back with a positive test.
Right. Well, I really appreciate you taking the time today to share with us what we should do, or what an employer should do should their employee be exposed to COVID, and what the procedure is. So, Casey, thanks so much for your time, and I know you're working a lot, you and your teams, and we just really appreciate all that you're doing. So, take care, and we'll talk soon.
Thank you so much, Katie. It's a mutual admiration today, because we couldn't do what we were doing here without your support, the chambers, all of our business service providers in our community, and the businesses. We know that this is an added piece of doing business, and doing business is already hard enough. And so thank you for all of your help and all your tireless work.
You bet. Take care.
All right.